Ma'am, we are live now. Ma'am, you may start now.
Okay. Can you guys see me as well? Okay. So, do we have Madiha here? Maddie, are you with us?
Yeah, I'm here. Can you hear me?
Yeah, I can hear you. I can hear you. Well, thank you
Okay.
so much for joining us and to be here with us. And okay, so we're just going to start in a while. But before we start, just going to introduce myself to you. I am Dr. Dure, one of the PLAB mentors from Med Institutors, and we'll be discussing a little bit about of counseling and pediatrics. We'll just give you a taste of how the real exam looks like and how the real exam how you can actually manifest your clinical skills and knowledge in the real exam, right? So we'll be discussing these counseling and pediatrics and just a little bit about Med Institutors for the ones who do not know. So Med Institutors is actually a trusted e-learning platform empowering doctors globally. At Med Institutors, we go beyond conventional study materials. Our platform is your one-stop destination for personalized assistance and insights tailored to your exam journey. So whether you're preparing for PLAB or you're preparing for any other postgraduate exam like MRCOG, MRCEM, MRCPCH, or other PG exams, we are here committed and we are here for you to empower you with the knowledge and the right skills that you really need for success, right? So it's a golden opportunity to refine your skills and boost your confidence in a realistic exam setting. And you're feel free to join us all. And so right now, before we start the session and before we start the actual mock, I want to talk to the listeners again that please listen very carefully, Dr. Saad and the other participants as well. And you guys have to give feedback at the end. Okay, first you guys will give feedback and then I will add on that feedback, and every feedback will be very valuable for the doctors who will present today in front of us, and they're having their exams in few days. Okay, so their time is money for them and for us as well. Okay, so let's just start. Have you set the timer? Backend team, I'm talking to the backend team right now. Guys,
Ma'am, we are waiting for your call.
perfect. Okay. Dr. Madiha, can you, so guys, it will be a telephonic consultation. So I'm going to discuss two scenarios today, one from counseling and one from pediatrics. So counseling station will be a telephonic consultation today, and the pediatric consultation will be a video call consultation today. So Dr. Madiha, can you see this scenario? Dr. Maddie, can you see the scenario on the screen?
No, I just see the first page still.
Now the scenario, you are in FY2 in GP surgery.
No, it's just the
Mr.
first. No, it's just the first slide still about Med Institutors.
Okay. Now, can you see?
Ma'am, we
No,
have.
do I?
Okay, so uh, can someone from the backend team control these slides?
Ma'am, give us 5 minutes.
Okay, Maddie, can you see now?
Yeah. Okay. So when's this timer going to start?
Whenever you're ready, do let us know.
Okay, I'm good.
Okay. Start the timer, please.
Wait a minute, ma'am.
Okay. Okay, start.
Hello, I'm Dr. Malik, one of the junior doctors. Am I speaking to Mr. Smith?
Yes, I'm Daniel.
All right. So can you please confirm your full your age, please?
Yeah. So I'm 24 years of age.
Mm-hmm. All right, Daniel. So I'm calling from the GP surgery that you visited. Is this a good time to talk right now?
Yes, perfect, doctor. Yeah, but doctor, I'm really worried, because I was waiting for my blood test reports, and I was informed that you're going to talk to me regarding my reports. Can you please tell me about my test results?
Okay. Okay, Jim. Daniel, that's exactly what I'm calling you about. But first, can you hear me properly?
Yeah. I can hear you properly.
Okay. Okay. And can you also please confirm your first line of address for me before we start?
Yeah, doctor, it's XYZ Hartman Square.
Mm-hmm. Okay, good. And also, would I be able to connect with you on the same line if this gets disconnected?
Yeah, doctor. Yeah, for sure. Yeah.
All right, sounds good. Okay, so I understand that you're here for the test results and you're expecting this call about that. But before I get into your results, would it be okay if I just have a quick chat with you about your symptoms or any the condition or the reason why you had the test in the first place?
Yeah, doctor. Actually, the reason why I had this test was, my brother, he got diagnosed with this condition, what you call, it's like sickle cell anemia. And
Right.
I've read it in the internet, and it says that it's a deadly disease. Oh my God, I'm so much scared about it. Doctor, do I have the same disease? Please, can you tell me?
Daniel, I understand your concerns, and I'm so sorry to hear that you were so impacted by your brother's diagnosis. How's your brother doing now?
Oh, I don't really care about my brother. He's not even living with me right now. And well, he's fine. He's fine. But I'm just bothered about myself. Can you please tell me
Right.
about my test results, please?
Sure, of course. I'll get into that just a minute. But before, can you please tell me if you have any other family members who have the similar diagnosis?
Oh no, doctor, no. Actually,
Okay,
it
and
was a big surprise for all of us, and we never knew that this is gonna happen. No, none of us has got tested before.
right, so it's the first incidence in your family if someone get diagnosed
Yeah,
with sickle cell.
yeah.
Okay. And have you yourself have had any symptoms for this disorder, like any symptoms at all?
Oh no, doctor. Like what? What are you looking for?
So, for example, sometimes people with this disease can get frequent pain attacks in their different parts of the body. They can have different infections or generally just feel symptoms of anemia, such as tiredness, weakness. Have you ever had any of those?
Oh no, doctor, never.
Mm-hmm. And are you just fit and healthy in general, or do you have any other disorders that anything you've been diagnosed with ever?
Oh no, doctor, never.
Mm-hmm. And do you take any meds, any medications for anything?
Oh no, doctor.
Okay. And all right. So basically, after your brother's diagnosis, have you found out more about this disorder or any information that you've had? Like, what's your idea about it?
I don't know anything. I just know one thing, that it's a deadly disease, doctor. And one thing I wanted to tell you, that I don't know, for some reason I'm not able to sleep these days. I mean, it's been 4 weeks now, and it's really affecting my work. It's affecting my studying. I'm not
And
able
so
to
this,
concentrate.
right. And so this sleep disturbance started ever since your brother's diagnosis?
Yeah.
So I can see that that must have had a huge impact on you like that. Okay, so now coming to your test results, should we discuss them?
Yeah,
Okay.
sure.
All right. So basically, I'm happy to assure you that you do not have the sickle cell disease itself. All right. Your test results show that you don't have the same disorder. However, your test results do indicate that you are carrying one of the genes for this disease. So before we get into, let me just explain it to you what that means. So the disease basically manifests in two ways. Some people can just be carriers, whereas other people can actually get the disease. Does that make sense?
Oh, doctor, does that mean that I'm carrying the disease? I'm not
Right, so let me
having a
explain.
disease, but I'm carrying it?
Yes, so let me elaborate more on that.
Okay.
So basically, we have two genes, and these genes detect the shape of our blood cells, right? And in sickle cell disease, like in your brother's case, what happens is that you get two genes for the disease,
Uh-huh.
and they end up manifesting in form of this disease. Whereas in some people can get one gene of the disease, but one normal healthy gene, and these people end up being carriers. Does that make sense?
Oh, yeah, doctor, that really makes sense. Well, thank you so much for such an explanation. So you really mean that I do not have the disease, right?
Right. So that's what I'm saying. You don't have the disease like your brother because he has two unhealthy or the disease carrying genes, but you have one normal and one healthy gene, which means that you are carrying it, but you will not have the disease. You do not have the disease and you will not get the symptoms of it.
Oh God, thank you so much, doctor. That was such a relief. And how is it gonna impact my general life?
Right. So basically, you will not have any symptoms. Sometimes what happens is that some carriers can get mild anemia, but none of that is very serious or doesn't warrant any further investigation or treatment really.
Doctor,
There
what
is
is anemia? What is anemia? I've heard it about something about it, but I don't know what is it.
right. So basically, sickle cell disease is also known as sickle cell anemia because it's a form of anemia. And what we call anemia is that it's an issue with the blood cells. So this is basically an issue in which the shape of your blood cells is abnormal, and so your blood cells don't live as long. And that's basically what the disease is called sickle cell anemia. So at worst, you will just experience some anemic symptoms, and at best, you won't have any at all. Um, you could, however, have one situation in which you might be able to transmit this gene that you have. However, normally, if your partner is normal and healthy, you will not be transmitting it to the kids. But if you ever have any symptoms and if you ever experience any worsening tiredness or any symptoms like that, please do let us know. And was there any other expectation that you had from this consultation today?
Yeah, doctor, can you please tell me regarding my sleep? I'm not able to sleep.
Right. So basically,
Okay. Well, thank you so much, Dr. Mehdi. It was a wonderful performance. It was a wonderful performance. And honestly speaking, the best thing that I liked about your, first of all, I'll talk about all the positive things, right? So the best thing in your consultation was that this is the way that we should do, right? So you are first of all, because you know that the patient is already very anxious, right? He's already panicking. He's not able to sleep for like 3 weeks, and it's impacting his life. So how to deal with such kind of scenario is to first of all give the positive, like positive news, to give the good news first, and then in a slider way you give the bad news, right? Like, okay, you're not having a disease, but you are a carrier, but you're not having a disease, right? So this was a good way of explanation. Okay, but before I explain it more, I would like all the participants to please one by one unmute themselves and please give a feedback, your very important feedback to Dr. Maddie.
Hello.
Yeah.
Well done, Dr. Madi. It was a very nice presentation. Firstly, you were quite polite, and also at the beginning of the presentation, the way you spoke to the patient, he was quite anxious at the beginning, and you were able to calm him down and tell him, okay, you're going to get to the results, but you want to ask some questions first, which is very good. And also, you were when he spoke about his brother, You acknowledged it and you were like, oh, I'm sorry about your brother. And it's very good IPS. Everything he was saying, you were acknowledging it, and you had a way of not just ignoring the patient, but trying to say, yes, I understand, but I would like to ask you some questions first. So it's just about communicating well and also taking note of everything the patient was saying. And also, when it was time to break the news about the results, the way you went with it, and also the explanation, you were not using very big terminologies. And even when you said anemia, the patient was like, okay, I didn't understand, that you were also able to pass your message across. So I'll just say you should just continue doing this. Is very good actually. With this performance, I believe even in the exam, you will do well. Just continue practicing and just doing this. Well done. Thank you.
Okay, that was a very good feedback. Thank you so much, Adiola. Anyone else? It just shows how good listeners you are, because there's one mark for listening as well. So if you want to perform well in exam, you have to be very good listeners as well. Okay. So anyone else from the team?
Dr. Dure, why not take feedback from Dr. Saad?
Yeah, Dr. Saad, are you there with us?
Yes, I am with you.
Perfect. Can you give us your valuable feedback?
I think the way she handled the patient is exceptional. But I would say that she should, this patient has raised concern regarding the sleep, so she should address the sleep while doing the management at first place, because it has affected the life of the patient. And
Yeah.
secondly, because she did a great job while talking to the patient, but when was she told that my brother is having these things, so she can ask, what are the symptoms your brother is having? And then the symptoms she told, okay, what are the treatment he is getting? And then she can say, do you have these symptoms? The patient will say, no, I do, because he's a carrier. So she's a carrier, so she will say, no, I don't have any symptoms, doctor. So then do one or two questions about the red flags, and then come to the rest of everything was fine.
Perfect, perfect. So anyone else wants to add?
Hello.
Hello.
Yeah, so I'm wondering, in this scenario, is it possible for to explain to the patient with a pen and paper to draw like some genes and explain, or is not necessary? Because merely explain to the patient, the patient might not get it as much as explain on a paper. So would that be all right to do in this station?
Well, that's a good question, but actually, you know what? That's what I always tell my students, that not to give a big explanations, right? We have to be very concise, because you can see how well she was managing with time, right? But she was not able to safety net in the end, and she was not able to address the concern of the patient very well, regardless of the fact that she was able to talk in a very swift way and a very flawless manner, right? But here we have to be very smart with the time. We cannot afford giving long explanation of just one thing, and then we'll be sacrificing the rest of part of the management, because I have seen people doing that, and they take literally 2 minutes in just explaining the diagnosis. Thank you so much for bringing that concern, because that was very important question to ask. Thank you so much, Dr. Aziza. Because there is a misconception of this thing as well. Sometimes people say that, okay, the definition should be like a teaching station. You should explain the patient like it's a teaching station. No, you have to give a very concise explanation that they should be able to understand in one go. And believe me, if your IPS is good, they won't they'll say, okay, that's good to go. Okay, they will
All
be
right.
able to
All right.
understand. Yeah.
All right. Thank you very much.
Thank you. Yeah. And I will explain everything in detail later. Anyone else who can please come up with a question or a feedback, valuable feedback?
Doctor, this is. Can I just ask a question?
Yeah, yeah.
Maddie did a great job with the IPS and everything. So I just wanted to know because she did not address the concern of the patient. When should she have asked the question about? I mean, addressed it. We usually keep it for the end, right? And then we might lose time. Is there any other order that we can ask the questions in there so that we can, address the concern in the beginning?
Uh, well, that's totally up to you. But because people, they what they do is that they follow their own patterns. Like there's one pattern that we call addressing the concerns right in the beginning. But I would not suggest that. Okay, it will just
Okay.
mess up the whole station. I always suggest to first of all finish the history and then explain the management and then address concerns. Right, and you'll be able to have enough time to address the concerns. But if you start addressing the concerns right in the beginning, I think you'll end up missing the station. That's totally my belief. But people, they actually do it. They start with presenting complaint, and then without before they go to history of presenting illness, they ask a question like, do you have any concerns, any particular concern that you have? And then they tell them that concern, and they can address it in a shorter way, or they can say, okay, we'll be addressing in the end. And even if they say this, it is actually recorded in the examiner sheet that they've addressed it.
Oh, okay. Thank you so much, doctor.
Yeah.
Got you.
So it's actually quite tricky. So you have actually in this exam is about time management. It's all about time management, right? So I'll talk about that as well in the end. Anyone else with the feedback? No one is there. I think we're done with the feedbacks. Or should we have? I mean, do we have something on the chat box? Let me see. Okay. Perfect. Okay, so now I'm going to talk about the whole station. Okay, Maddie, are you with us? Are you listening?
Yeah, I'm here.
Okay, perfect. So it was, everyone is actually praising your consultation, and it was an exceptional consultation overall. But let me tell you where you can improve, right? Because we're not here to, we have to motivate each other to participate as well. And it was a very good, but you need to know where you were lacking, right? So, okay. So first of all, the history could be like, when I said that, okay, like what? Like when you were collecting the data. First of all, let's start from the beginning. It was a wonderful beginning. Like you asked all the questions that we are supposed to ask in a telephonic consultation. Believe me, guys, I've been taking mocks since like a long time, and people, they do not have this idea of the importance of the telephonic consultation questions or video call consultation questions. They simply forget asking about the address of the patient. Okay, like, can you please confirm the first line of address for me? Can you hear me clearly? Or if it's a video call consultation, then there's like a 4 or 5 set of questions that you need to ask before asking the history, before addressing the concerns, before anything that you want to do in that station. Because if you do not know how to approach the patient on a particular scenario, like if it's a video call consultation, there's a particular approach towards video call consultation. If it's a teaching scenario, there's a particular approach towards teaching scenario. If it's a breaking bad, there's a particular approach for that. They're actually looking how much well oriented you are in your time place person. Okay, if you're not going to ask the video call questions in the beginning, telephonic questions in the beginning, that she did really well, I must appreciate you. But I've seen a lot of candidates missing these questions because in their head they think that, okay, maybe this is not that much important. But believe these questions are very important, even more important than your, the other differentials, the other management parts. Because I've lost my stations in my first attempt. I couldn't pass my exam. And I'm proud to say that because I can share you my experience, okay, what happened with me, because nobody told me of these things, right? So these questions, they're very important. Like, can you hear me clearly? Can you see me clearly? Is it the right time to talk to you? Can I call you back on the same number if this call disconnects? If it's a video call consultation, can I call you back on the same link if this video disconnects by any chance? Okay. So can you please confirm your first line of address for me? Name and age of the patient. And then you're allowed to ask the other questions. Number one. And then, okay, so the other question, you have to be very quick in the history taking. You don't have time there to think what you will ask. So it's like literally a mind game. You have to be very quick in asking the questions. So she was very quick in the history, but when I asked, like, okay, like what you're going to ask, so she, you jumbled up with a lot of symptoms. Okay, so the patient present in this way could be, you can have tiredness, you can have this. That was too much to say. That's totally my perspective. Maybe some examiner would like it and they do not mind it, but some maybe they say that, okay, that was too much for the patient to. Patient says, okay, like what? And they'll say, no. And believe me, is no, dizziness, no. They'll be quick in answering. So do not worry about that. But sometimes they're actually testing your nerves as well. They're playing around with your nerves by, some delay tactics. They'll talk slow, but then that's scripted and they're assessing you on that part, right? So they'll also judge you on your overall performance and not one tiny thing. So that's also one thing to do. So yeah, we can talk about shortness of breath, dizziness, chest pain, fever, weight loss, body aches and pains, joint pain. Okay, we should not go into a lot of detail asking these questions. She missed allergies as well. Okay, so but that's fine. But you have to ask these questions. They are important. So try not to miss asking allergies, because for them, allergies is a very important thing that a doctor should rule out before, consulting. Moving into the management part, right? So you have, like, be quick in it, like shortness of breath, dizziness, chest pain, fever. So only the symptoms regarding the sickle cell anemia, and then you can talk about the parents. She did ask about the parents, okay, and sleep history. Believe me, here we don't have that much time, but just one or two questions regarding sleep to rule out the other differentials. Okay, like at what time do you go to sleep? Okay, is your sleep environment comfortable? That's it. Like only one or two questions, just to make sure, just to let the examiner know that okay, she's ruling out the other differentials for insomnia as well, because this is a very challenging scenario, and it's a high yield case, and it's actually coming in your real exams. So it is a challenging scenario because it is not only a follow-up case, but it's a case with the patient who is coming with insomnia as well. Mary, are you with me, right?
Yeah.
Yeah. So it was a challenging scenario in a way that it's not only a follow-up scenario where you have to explain the blood test results, but it was a scenario with insomnia as well. So, but of course, you do not have to go into a detail of insomnia, because there's like hundreds of questions to rule out the insomnia differentials and blah blah. But just one or two questions, just to let the examiner know that you're ruling out the other differentials as well. Okay, and then after that, quickly pass medical history. And you didn't have time, of course, of smoking and alcohol. But whenever you're moving from one part of the history to the other part of the history, always and always signpost. It shows how well structured you are, and it shows how well oriented you are Okay, and showing your structure is also very important to the examiner. So you have to signpost when you're moving from past medical to lifestyle. And in lifestyle, you just need to ask about smoking alcohol. Okay, there's one very important thing that I'm going to tell all of you who are listening to this. Smoking and alcohol is very important, and there is no excuse for not asking about regarding smoking alcohol, regardless of the case. Smoking alcohol is important. Okay, so it's always better to ask smoking alcohol, because you never know, the examiner has one mark for smoking and alcohol, and maybe they have smoking and alcohol history hidden. So there's no excuse for not asking smoking and alcohol. So smoking alcohol, you will ask. So the whole idea is to be a bit fast and be, you have to ask only the relevant question, because there are hundreds of questions you can ask, but you have to be relevant. Okay. After that, yes, so he was also having anxiety, panic disorder, but okay, you do not need to rule out, because you have this diagnosis already in your mind that he's anxious because of his brother's diagnosis. That's the reason why she asked idea. So idea is very, very important. It will help you in making a diagnosis. It actually helped me in my real exam in understanding what the patient is actually having, and they actually help you when you ask, have you had any thoughts in your mind what might be going on at all, or do you have any idea what's going on? They will tell you that, they'll not bluff, they will exactly tell you what's going on. So it actually helps you in your exam asking regarding this idea. Okay. So regarding the management, yes, everyone has given a very good feedback, but the management was that you were not able to address sleep issue, because here, of course, we do not have that much of time that we tell all the do's and don'ts of insomnia. And in the real exam, we really do not have time to tell all the general tips regarding a specific scenario. So what we should do is that when you know that you have just 1 minute, okay, one thing more, that this timer was for 7 minutes, it was not for 8 minutes. So in the real exam, you will have 7 minutes and 30 seconds in actual. So you'll have 30 seconds more. So you will be able to cover a lot more details. And if you've practiced very well, there's one more thing with some people, and it happened with me as well, that you finish before time. That's also a red flag. Even if you finish before time, do not stop talking. You have to try not to like let the silence hit the station. Okay, not let the silence hit the station. Like, you have to talk, right? Engage the patient, but do not make it sound like a verbal diarrhea. Okay, so that's one thing. Thank you so much, Dr. Mary. Now a bit about the scenario. Just a second. Where's the presentation?
Dr. Dure, we have a few more new participants, so you can ask them if they want to participate.
Okay. But actually, we have one participant. They can be listeners for today, because we have one participant, Dr. Saad, with us, and he has exam in few days. So we have committed with him already. Dr. Saad,
yes.
Are you with us?
That's right.
Yes, I am.
Yeah. So we can't be not fair with the students who we have already committed. Okay. So just a few more things about sickle cell disease. Sickle cell disease is actually the name for a group of inherited health conditions that affect the red blood cells. The most serious type is called sickle cell anemia. Sickle cell disease is particularly common in people with an African or Caribbean family background. Okay, so people with sickle cell disease produce unusually shaped red blood cells. Dr. Maddie did told us about this. Okay, that can cause problems because they do not live as long as healthy blood cells and can block blood vessels. So these slides they're prepared from NHS guidelines. Okay, so do follow the NHS whenever you have any problem in any part of your theory or any topic. Go to NHS website, okay, directly. Do not use like notes here and there, just see NHS. and they will give you the simplest explanation that you can actually use in your real exam. People with sickle cell disease produce unusually shaped red blood cells. See how simple it is. That can cause problems because they do not live as long as healthy blood cells and can block blood vessels. So, sickle cell disease is a serious and lifelong health condition, although treatment can help manage many of the symptoms. So, it can cause a wide variety of symptoms that you can actually ask in their history to rule out if they're actually having these symptoms or not. So painful episodes like body aches and pains, any joint pains, any headache, okay, and getting infection, they're more prone of infection like pneumonia, meningitis, or respiratory tract infections. They can also have acute chest syndrome and anemia. So, yeah.
Ma'am, we have a question in the chat box.
Okay, so I'll answer those questions in the end. Let me finish this sickle cell disease.
Okay, sure, ma'am.
First. Yeah. So, sickle cell disease can also sometimes cause a wide range of other problems, and these include delayed growth during childhood and delayed puberty, and then gallstones, which can cause tummy, abdominal pain, yellowish discoloration of the skins and eyes, like jaundice, bone and joint pain, persistent and painful erection of the penis. Okay, so yeah, but that would be too much if you will ask this in the real exam. But this is just to let you know that this can happen. So actually, patient can present with erectile dysfunction, having this problem. So it's important for you to know that this can happen because actually it will affect the blood flow. So it can affect wide variety of symptoms. It can give you wide variety of symptoms. Okay, so which can sometimes last several hours, and they can have leg ulcers, they can have strokes, they can have TIA, myocardial infarction, they can have serious lung condition like acute chest syndrome, which can cause fever, cough, chest pain, breathing difficulties, swelling of the spleen like shortness of breath, rapid heartbeat, tummy pain, swollen tummy. They can have anemia and they can have eyesight problems as well because of clots in the eyes as well. So, like in diabetes consultation, in heart, in high blood pressure consultation, we tell na that these clots they can either travel to your large blood vessels, they can travel to your small blood vessels. So you have to be prepared. You can do not be scripted or do not limit your mind like okay so I've read about this case only carrier will come. No, sickle cell disease can also come in your actual exam, so you should be able to know how to counsel that sickle cell disease patient that okay so you can have problems in your small blood vessels, you can have problems in your large blood vessels. Small blood vessels will affect your eyes, will affect your nerves, and large blood vessels can have problem with your heart, brain, or kidneys. Okay, so high blood pressure in the blood vessels that carry blood from the heart to the lungs, okay, and pulmonary hypertension, kidney or urinary problems, including blood in the urine and bedwetting. So how sickle cell disease is inherited? This was important, and this is actually it's very tricky to actually make them understand this thing, and you cannot take a lot of time, so you have to be very simple with the explanation. So that's the simplest explanation that's written here. That genes actually comes in pair. You inherit one set from your mother and one set from your father. To be born with sickle cell disease, a child has to inherit a copy of the sickle cell gene from both the parents. This usually happens when both parents are carriers of the sickle cell gene, also known as having sickle cell trait. This this was the case of sickle cell trait. So, or it can happen when one parent has sickle cell disease and the other is a carrier of it. Okay. So, sickle cell carriers do not have sickle cell disease themselves, but there's a chance they could have a child with sickle cell disease if their partner is also a carrier. So here I would again say that Maddie did a very good job by saying the positive thing first, because I've seen many candidates, what they do is that, okay, you can have a child with sickle cell disease. I mean, you're shocking the patient by saying this, that you can have a child with sickle cell disease. You can't break the bad news in this way, right? Just say, okay, you can, whenever you're getting married, whenever you're planning to get married, it's always advised to test your partner as well enough, because there's a chance of inheritance, there's a chance of passing these genes. So it's always advised to test your partner as well before you get married. That's it. You don't have to get into a lot of details, otherwise you'll just get in trouble. But there's a chance they could have a child with sickle cell if their partner is also a carrier. So both, and they might ask, okay, doctor, what is the chance, of my child having this sickle cell disease? Then you can say that there's 1 in 4 chance that they will. Okay, so there's 1 in 2 chance, like 25% of a chance to be a carrier, 25% of a chance to be a diseased person. Okay, and then there's 75% of chance that they will not inherit any sickle cell genes and will not have sickle cell disease as well. Always show the brighter side of the picture first to calm the patient down, even in your actual practice. So having children. If you carry the sickle cell trait, you're at risk of having children with sickle cell disease. Although this can only happen if your partner is also a carrier or has sickle cell disease themselves. But if you're planning to have a child and you know you're a carrier, it's a good idea for your partner to be tested, as I've mentioned, right? So it's always, you have to tell this in the management as well, that if you're planning to have a child, it's always better and it's advised to get your partner tested. And if you can just ask in the history about the partner, if they say that their partner is also a carrier or something like that, then you have to refer them for genetic counseling, okay? If both of you are carriers and you're planning to have a baby, talk to your GP about getting a referral to a genetic counselor who can explain the risks to your children and what your options are. And these include having tests during pregnancy to see if your baby will have sickle cell disease. Okay. So this is for the scenario that now they're married. Okay. And both of them are carriers and now they're worried, they're having a child. The woman is pregnant and they're worried about their baby. What to do now? So we have solution for that as well. Do not worry. What we can do for you is that we can arrange some tests during pregnancy to see actually if your baby will have sickle cell disease or not. This is the best idea, best solution to give. And then you can, either you can adopt a child, okay, or you can try IVF with a donor egg or sperm. Try a pre-implantation genetic diagnosis. Okay, but this is, I don't think it's offered by NHS, but you can recheck it from CK's guidelines. So pre-implantation genetic diagnosis can also be done, and it's like pre-implantation genetic diagnosis, so it will actually show that your child will have this or not, because there's only 25% of chance to have and 75% of not to have, so there's more chance not to have. So if they're not going to have it, you can carry on with the pregnancy. So yeah, so there was insomnia as well in this case. So the patient was having sleep problem. And she okay, so this is one thing very important, that if you will build a very good rapport with the patient, they will help you. And in some cases, if you are not able to build a very good rapport with the patient, they might not help you. And in that case, you have to ask, in each and every case, regardless of the scenario, you have to ask effect of symptoms, impact on their general health. Okay, and they'll tell you that, oh, doctor, it's affecting my life terribly. I can't go to work, and this is a red flag for them. Then you have to do something for them. Okay, you have to give them a one-line solution for that. So this patient as well, he told Mr. Daniel Smith, he told that, oh my God, doctor, my life is being affected. My work is being affected. So then you have to tell that, okay, so as you told me that, your life is being affected, I'm just going to talk about how you can manage your lifestyle regarding your sleep as well. That's it. Even you do not tell everything regarding the do's and the don'ts and everything, you'll still be marked because you actually mentioned, because the examiner also knows that, this is a challenging station and they won't be having time. Nobody will. But if you've mentioned, because there are smarter candidates out there as well. And believe me or not, guys, it is a competitive exam because you're being judged by the others. If everyone is actually saying that we're talking about your lifestyle, we'll talk about your sleep as well. and you're not going to talk about that, then you won't be marked or you won't be able to pass that station. So you have to be very smart with the time that you use in your consultation. So even if you say that, okay, as you mentioned that it's affecting your life, I'm going to talk about your sleep as well, like how you can manage it. That's it. They'll give you marks. Okay. And you also, there's also one smarter way of giving the summary and covering all the points that I can tell you whenever you want to book your personalized feedback sessions or personalized sessions with institutors. And okay, so insomnia do's and don'ts: go to bed and wake up at the same time every day, relax at least 1 hour. These do's and don'ts you can use in the other stations or in the stations that you have time. Even in this station, if you have got time, you can talk about this. Like go to bed early, wake up early, relax at least 1 hour before going to the bed. Make sure your bedroom is dark and quiet, and use curtains, blinds, an eye mask, or earplugs if needed, and exercise regularly during the day, and make sure your mattress, pillows, and covers they're comfortable. And what are the don'ts? Do not smoke or drink alcohol. So this was also important to ask, right? Smoking, alcohol, tea, coffee. Smoking alcohol, there is no, as I said, there is no relaxation of not asking smoking alcohol. You have to ask in each and every station. Of course, not for a pediatric patient. Okay. So do not smoke or drink alcohol, tea or coffee at least 6 hours before going to bed. Do not eat a big meal late at night. Do not exercise at least 4 hours before going to the bed. Do not watch television or use devices like smartphones right before going to the bed, because the bright light makes make you more awake. Do not nap during the day, and do not drive when you're feeling sleepy. Not sleep in after a bad night's sleep, and stick to your sleeping, or you can maintain a sleep diary as well. Okay, because this case was also long-term insomnia case. He was not able to sleep for 3 weeks, and the only reason was because he was anxious. He was worried because of this diagnosis. That was the only reason. So yeah. Okay, so after that, you should mention like warning signs, follow-ups, and offer leaflets. Okay, there's one more important thing and one misconception that I actually thought that uh, warning signs, mentioning about warning signs, mentioning about leaflets, follow-ups, everything is very important. The first and foremost thing is concern of the patient. Okay, there is no relaxation of not answering the concern of the patient. If you've satisfied the patient, you have answered all the concerns of the patient, you'll be able to pass even if you have not done the safety netting. Okay, but do not do this mistake that the patient is asking you a question, okay, and they're asking you a concern, and you're like thinking, oh my god, I will lose mark for safety netting, I will lose marks for not mentioning the leaflets and follow-ups, and let's just jump to that first, and you ignore the concern. Don't ever do that, because you'll definitely fail that station if you're not able to answer the concern, if you're not able to satisfy the patient. Even if you're rushing through the station, do not let the examiner have this impact that you're rushing through the station or trying to cover each and everything. No, it's not that kind of thing. You have to be very smart, answering everything in a polite manner. Don't be slow and lazy in answering things, but of course, trying to cover everything on the same part as well. So, yeah, not an easy exam. Anyone wants to say something?
Api kita. Api.
Okay. I thought maybe someone wants to talk. Okay, so let's answer the queries and then move to the next station.
It was
Yeah.
Dr. Ashfaq.
Okay. I'm going to first answer the queries, and then I will move to the other station. Okay. Nice. You were saying that there's one query, right? She handled it efficiently. My mind was blown away with her understanding. That's Okay. Oh, did anemia affects on marriage life? Uh, yeah, it can affect on married life as well. As I've mentioned that it can actually cause a a penile discomfort. It can actually cause penile dysfunction as well. So it can affect marriage life. What we do if patient is not in census? Well, the patient will be in census. Is not a psychotic patient. She handled it efficiently, okay, but I think she should have explained more on the likelihood of transmitting this gene. Yeah. Okay, perfect. Let's move to the other station. Just a second. Okay. Scenario 2. Can you see this, Dr. South? Are you with
Yes,
us?
I can see. Yeah.
Your voice is not clear.
Uh, Hello, can
Yeah,
you
yeah,
hear
yeah.
me?
Yes,
Okay.
now we can hear you. You can take your time, read this scenario. Okay?
Okay. Mm-hmm. So I have the sickle cell scenario. I have the same scenario.
No, 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 it's different. Can you see the scenario?
No, I have the same scenario.
You have the
That
same
is
scenario.
Mr. Daniel Smith, 24 years of age.
Um, uh, can anyone in the backend team please control? I don't know why it's not moving there. Wait. Okay, okay. Wait. Now I'll control. Actually, there are 2 or 3 slides. Okay, now I can. Uh, I'm just doing a mock 2 scenario. Can you see it now?
Yeah, I can see.
Yes, ma'am. We can see your slides now.
Okay.
Okay, so you're ready?
Yes.
Okay, so it's a video call consultation.
Mm-hmm.
So you need to turn on your camera.
Okay.
Perfect.
Ma'am,
Okay.
can
Hi,
you let me
nice
know
to
when to
meet
start the
you.
timer?
Okay. Uh, we're going to start the timer.
Mm-hmm.
We're able to see you.
Enter the room.
Okay, start.
Hello.
Hello.
Uh, am I talking to Miss Anna Smith?
Yes, I am Anna.
Okay. Miss Anna, how may I help you today?
Oh, doctor, I'm really worried about my child.
Okay.
He's bedwetting.
All right. Okay. So, Miss Anna, I am. Let me introduce myself. I am Dr. Saad, one of the doctors in your GP clinic. Okay. So
Mm-hmm.
before going to move forward, let me ask you, what is the name of your child?
Yeah, doctor, he's Jason Smith.
All right. Okay. And can you confirm his age for me?
Yeah, doctor, he's 4 years old. He's 4 years of age.
So can you confirm the last address of your house for me?
Yeah, it's XYZ Hardman Square.
Okay. Thank you so much for confirming the details. So you booked an appointment, and so can you tell me more about why you have booked
Oh
and
yeah, doctor.
why are you concerned?
Yeah, doctor. I'm really worried about my child, and I don't know
Mm-hmm.
why he started bedwetting.
Mm-hmm. Okay. So since when he has done this?
Oh, doctor, it's been a few days now.
Okay, and before that it was okay.
Yeah, it was okay. There was no issues.
All right. Okay, and any pain while urination?
No, not that I noted.
Okay.
He
Is
never
there any
told me actually.
okay? And is there any specific time when he do this?
Specific time in the night?
Night or in the
Mm,
morning?
Um, no, actually in the morning because he's potty trained, so he go to the loo by himself.
Mm-hmm.
But there's no
Okay.
specific time in the night, but he's doing it for a
Mhm.
few days now, and that's
Okay.
quite worrying.
All right. Okay. All right. And apart from that, any recent change in his life?
Like what?
Like any recently going to started some school?
Yeah, he's going to a nursery. Yeah,
And since when?
since when? It's been 1 year now.
Okay. All right. And how much water he drink before going to sleep?
I've never counted. Like I don't know
No
about that.
problem. No problem at all. And does he take some cola drinks or coffee or caffeine?
No, 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 doctor. He's just a
All right.
child. Why would I give
Okay.
caffeine to my baby?
Okay. All right. Okay. Right. So because sometime the child usually takes some Coca Cola and stuff like that. So any tea.
No, no, doctor. No.
Okay. Okay. And any fever,
No,
any constipation.
no.
Okay. And he told me that he was fine before that. At any time he has that same problem before since his
No,
birth.
no, no, doctor. He never had it. Yeah,
Okay.
he never had this problem before.
Okay. And how was the birth of your child?
It was fine, normal.
Okay. And is he up to date with the jab?
Oh no.
No?
Actually, yes, 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 yes.
Okay. All right. And are you happy with the red book?
Yeah, I'm pretty much happy with the red book. Yeah.
Okay. And is he eating well these days?
Yep.
Okay. All right. And has he been diagnosed with any medical condition in the past?
No, doctor, never.
All right. And any family history of any medical illness?
Yeah, doctor. His father is type 1 diabetic.
All right. Okay. Okay. And all right. Okay. And apart from that, is he has some allergy?
No, no.
Okay. All right. Okay. Has he started drinking some more water these days?
Yeah, doctor. I've noticed one thing that he's drinking quite often. Yeah, that's a bit more. I don't know why.
Okay. Okay. And when he passed the loo, does you feel some fruity smell?
No, 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 no.
Okay. All right. Okay. That's fine then. Okay. And apart from that, anything else that you want to tell?
Yeah, doctor. I don't know, but he seems a bit tired these days. Probably he's just playing a lot in the school. Probably that's the reason.
Okay. All right. And how it has impacted you and in general?
Oh yeah, I mean, not a lot, but I'm just worried. That's why I booked an appointment. Can you please tell me what's going on?
All right. So thank you so much. It can be because of many reasons. So it can be because you have a history of diabetes, like your husband has. So it can be because of diabetes, and sometimes it can be because of some infection in the urine, or sometimes it can be a natural process that a patient or the child might be having some increased water intake. That might be the reasons. So I would like you to come to the GP so that we can assess her and examine her properly in order to find the root cause. Is that okay?
Okay, so doctor, when should I come to the GP?
Okay, so you can come, you can book an appointment tomorrow.
Okay,
All right,
so
okay.
that's fine. Okay.
Okay. So if we find, because and we will refer you to the, if we find something unusual, we will refer you to the specialist. Okay, they might do some tests like urine dipstick. Okay, and some tests for diabetes. Okay,
But you can do these urine dipstick tests in the GP. You
I can
will
do, but
refer me to the specialist.
yeah, I completely agree. I can do, because your child was having no problem before that, so we need to refer her to the specialist in order to find out what is wrong with him, and we need to examine him as well. Okay,
Okay.
and
And
moreover,
what else you can do?
all right. So, and I will also tell you that you don't need to be worried, and we are here for you. And I will also send you a link from the NHS website. You can go through that.
Perfect. Okay. Good performance, Dr. Saad. You were a bit close. I will tell you what was, what was wrong. But before that, we have listeners in the chat. Anyone wants to add their valuable feedback? Dr. Abdullah wants to talk, I think. Please, I encourage everyone to participate in this, and it will be helpful for Dr. Saad as well. Participate in this and let us know regarding your valuable feedback. Anything that you guys think that he should improve?
Hello.
Hello.
Well done, doctor. It was a nice presentation. However, at the beginning, I think it's a telephone conversation, and there are some questions you have to ask, like the address and if she was okay to talk and some of that. But I think you missed that at the beginning. And also, there was a particular time when you were giving your explanation of what you think it was wrong. You were just talking and not trying to check if she was following you, you understand? Because you were just saying too much and not trying to recognize if she was following you. So that's another thing that I observed.
True.
Yes.
So, sorry to interrupt. You are absolutely right. I should be more, vigilant. I should be counter checking his that either he understands or not. But before to the first point, I will.
You did ask. Yeah.
I did not ask about the thing. It is the right time or not, because the patient called me. It was the patient who booked the appointment. It was not me who called. Patient booked the appointment, so that is why I did not ask why is it the right time, because patient called me.
Okay.
Yeah.
All right. It's just like
When the patient is calling you, then even if you don't ask this question, it's okay. But even if you ask this question, you won't be negatively judged. That's my personal belief, that you won't be negatively marked. Even if you ask that question, it shows how safe you want to be, right? So it's okay to ask that question. But even if it's not a very must to do, but the must question is confirm the address. That he did. But thank you so much, Dr. Adiola. Your feedbacks are really nice. It shows how good listening skills you have. And she was talking, she wanted to talk more. Dr. Adiola, are you done with the feedback, or you want to add more?
Well, it's okay. I'll just leave you to say the remaining things.
Okay.
Thank you.
Thank you so much. Thank you so much for participating in this and giving us your valuable feedbacks. Anyone else? He kept confusing if the patient was she or he. That may indicate poor listening skills. Yeah, but yes, it can affect, but it won't majorly affect your skills, because believe me or not, they're not actually looking for your English language skills. They're actually looking how good you are as a doctor, how compassionate you are as as an individual, and how passionate you are towards your patient. So grammar does not really matters, but yes, he or she these things they are bit important, but not to that extent. Yeah. So the ones I've seen people passing their exams with flying colors who do not even know how to talk in English. So I know that. That does not really matter. Grammar does not really matter. You should be able to actually try to convey the message in an appropriate manner. The station should be like interactive. Okay. Anyone else? To work on listening skills. Also, he seemed a bit anxious, which made him confused while talking to the patient. Yeah, we can say that. Okay. So this was anyone who don't who wants to add on the feedback in the chat box as well. They can add. It is not just about grammar, but since this is a genitourinary case, don't you think a girl and a boy? Yeah, for sure. Yes, yes. Without a doubt. Yes. He or she does matter. Yeah. So, Dr. Saad, please work on that. Are you listening? Are you with us?
And thank you so much. I am really, it is very helpful that you people are giving me a great feedback. So thank you so much, everyone who is writing for me, who is talking to me. And it is, I have no words for you people. Thanks a lot.
Oh, that's so sweet of you to thank you us. Anyone else? I would appreciate more and more. Please, it will be helpful for him because he's having exam in few days, and you'll get lots of prayers from him, his side as well. So I would appreciate all of you guys to give your valuable feedback. Once I'm sure that I'm done with the feedback, I'll go with my feedback and then explaining the topic. So Dr. Maddy, are you with us or you've left because she also have exams in few days? I don't know whether probably she is with us right now or not, but she must be really busy with her exam preparations.
Ma'am, Dr. Maddy has left. She has an exam. So she
Yeah. Yeah, she has
And
exam.
also we have a question in the chat box.
Okay. I have a question. Okay, go on. Please tell me more about my mistakes. Okay, it would be really helpful for me. It is, you asked him, when should I come to the hospital? What would be the right answer? Yes, so I'm coming to this and the whole management thing in a bit, and I will explain it. It was actually an immediate referral. It was not a referral to the GP clinic. So yes, the management was bit here and there. It's okay. But remember, Dr. Saad, we've discussed this case with a lot of mentors, everyone, and it's an immediate referral. I will tell you the reason why. Okay, anyone else who wants to add on the feedback? I will wait. If anyone is willing, they can unmute themselves. I will wait for a couple of minutes and then I will go on with my feedback. Okay. Well, no worries. Okay. So I think we're done with their feedbacks. There were valuable, very much valuable for us. So let's just start with my feedback first. Okay. So it was a good consultation. Yes, as like the patient was anxious and you did ask all the video call questions that are really important, but you can just add on, but that's totally up to you. If you think that you can manage the time in the rest of the station, then you can just add on this question. Can you hear me clearly? Can you see me clearly? Okay. And then could you please confirm the first line of address for me? So is it the right time to talk to you? Even this, you can ask whether the patient is calling you or you're calling the patient. You can ask this question, is it the right time to talk to you? Okay. even okay, so two questions, they're optional. Is it the right time to talk to you, and can I call you back on the same number if this call disconnects, right? But three questions, I would say this is a must. The reason why I say it's a must, because it shows how well oriented you are in your time place person, how composed you are as a doctor. And believe me, they're actually looking for a very composed and pronounced doctor, right? So they want to see how well oriented you are. So it will give a good impression. Why? Because I've seen a lot of candidates not even asking a single question, and I've already talked about this, so I'm not going to take a lot of time in explaining the same thing. So can you hear me clearly? Can you see me clearly, right? And could you please confirm the first line of address for me? It will actually show the examiner that, okay, so now this candidate, because there will be lots of stations. You never know that you're doing a seminar and then you're doing a video call, or you're doing a teaching session and then you're doing a video call. It will show the examiner that, okay, so he is so much oriented that he knows that he's talking to a patient on a video call, and he needs to check whether the patient wants to see them, patient is able to see them or hear them. So this is an important question to ask. Okay, so can you see me clearly? I mean, can you see me clearly? Can you hear me clearly? Okay, so this is something very important to ask. Okay, otherwise in this scenario, so you missed your diagnosis. It was type 1 diabetes. Yes, you did. You were able to actually understand what's going on. Dr. Saad, are you with us?
Yes, I am keenly
Yeah, yeah,
listening
yeah,
to
yeah.
you. Thank you.
Okay, thank you. So you were able to understand actually that what was the diagnosis, okay, but you were not able to understand the seriousness of the diagnosis. You did ask, in fact, you did not ask any specific question, so I was not able to answer you regarding that. Whenever, okay, in PLAB 2, always remember, whenever there is pair, always compare. Okay, so day and night also comes in pair. So whenever there are night symptoms, you have to ask about the day symptoms as well. He did ask me regarding one thing that, okay, do you think he's drinking quite more than usual? And I said yes, he's drinking more than usual. Then the next question should be, is he having, come directly, when you have this one clue of diabetes, come directly to the diabetic questions. Okay, like you can ask about weight loss, you can ask about tiredness. Okay, he did not ask me regarding specifically regarding tiredness, but at the end he did ask me, is there anything else that you want to tell me? Okay, so it is also an open question, and sometimes it encourages the patient to tell what they're hiding. Sometimes they don't tell you, so you have to be a bit specific. Okay, so in PLAB 2 I will always tell you to be specific, because if you've not developed a very good rapport with the patient might not open up because they don't like you. Sometimes it happens in the real exam. That's why it is called a very subjective exam, that if they don't like you very much, they won't open up. And if you've not built a very good rapport with them, they won't open up. Okay, but if you ask them a specific question, they have to open up. Okay, so like he did not ask me a specific, but he did ask an open question which can actually open up a patient as well. So he asked, is there anything else that you can tell me? And I did said yes. I'm I think that he's a bit tired these days. So this was a clincher for DKA or type 1 diabetes. So it is written in the NHS and CKS guidelines that the patients whom you are suspecting that they are, whom you are suspecting with type 1 diabetes, regardless of DKA, you have to immediately refer them to A&E. They should be seen on the same day, not the next day, because you don't know, maybe they will go into diabetic ketoacidosis and they might die. And this was a very tricky scenario. It's not an easy scenario. It's a high yield case and a very tricky case. So people get stumbled in the but if you will ask the specific question, you will not lose marks. So weight loss was the specific question. Tiredness, he was actually having a weight loss as well, but he didn't ask me, so I didn't tell. But if he would have, okay, and there were daytime symptoms as well. He didn't ask me regarding the daytime symptoms. Okay, what is the routine in the daytime? Okay, so then I will tell you that, okay, yes, doctor, he's going to the loo quite often in the day. Okay, then you will ask regarding, okay, it could be infection, it could be diabetes as well. So he did give the differentials, but okay, so I would say that try, first of all, try your level best to give a single diagnosis, to be able to make a single diagnosis. But in the worst case scenario, if you're not able to make a single diagnosis, then even if you're giving a differentials and your structure and everything is nice, you'll be able to pass. But it really depends on the performance of the other candidates as well. If everyone is struggling in this scenario, then you will pass. But if everyone is doing the right way and you're the only one who's giving differentials and not doing it the right way, then you'll fail. So it is a subjective exam that way. Yeah. So fast heart beating. He did ask me regarding fruity smell, but there was no fruity smell because it was not to that extent yet. Okay. But it was a serious scenario. So there was weight loss, there was tiredness, there was going to the loo more often, and also in the daytime, and also there was like increased thirst as well. So all the symptoms and signs were positive for type 1 diabetes. So it was a clear cut type 1 diabetes. Also, he asked me father history. So that was also positive for type 1 diabetes. So here you should mention that, okay, so I'm going to immediately refer you, not tomorrow. Believe me, if you'll send the patient to the GP, you might lose the station. You'll immediately refer this patient to the A&E, and this patient will be seen by the specialist, the hormone specialist. They will come in the A&E and they will see this patient, and they will do the, all the routine blood investigation, including the blood sugar levels and the HbA1c. Everything will be done there. And if he's diagnosed with diabetes, okay, God forbid, if he's diagnosed, then he will be assigned by the diabetic nurse, who will tell the further details, how to, what to do in the future. And then you can just finish off the station by addressing the concerns and mentioning the red flags. Okay, at any point of time, if you feel that your the child breathing rate is fast, okay, he's becoming short of breath, or if you're, if your child is experiencing any fruity, smelly breath or something like that, come back to us. Okay, just call us. Anyways, you're sending this patient to A&E, but still, just for your exam purpose, you have to mention the warning signs. Okay, and the end of the session, if you have time, you can always mention the summary as well. Exactly. So, Dr. Saab, do you want to add on something?
Yes, I am very thankful because it's because I put the life of patient in danger. So it is really difficult for me to pass the station, because if you are not referring him immediately, it might affect his life. So you are absolutely right, and I should be more careful in that, especially regarding the situation like I've got in this scenario. So I am very thankful because what I have learned from the PLAB 2, I think it is not to treat the disease, it is to treat the situation or to manage the
Situation.
situation.
Exactly.
So because I was unable to manage the situation because my patient's life was at risk, and I was telling him to come to GP rather than asking him to go to the emergency immediately. And if you want to need any help regarding calling the ambulance or anything, I will be there for you. I should be telling him these things because I was not here to treat the disease. I was there to manage the situation.
Manage the situation very well, very well.
You are
And
absolutely right.
Dr. Yeah, and one thing, good news for you is that you will ace this station. You will get 12 out of 12. Now, if this station comes in your real exam.
Yeah, that's true. That's really true.
Yeah. So this is the whole idea of, that's why I appreciate all of you to participate more and more, because if this station is going to come in your real exam, believe me, guys, you will just ace it. because it
That's
is now very well discussed. Yeah. Okay, so also thank you so much for joining us, and wishing you best of luck for your exam.
thank you.
Okay.
Thank you so much, Dr. Dure. It was a wonderful session.
But we're not ended yet. Okay, so I'm just going to explain a bit more regarding what is type 1 diabetes. Type 1 diabetes causes the level of glucose, okay, in your blood to become too high. And it happens when you, okay, so uh, we actually struggle. Sometimes we really struggle in how to define, right? So, how to define diabetes as well, how to define insulin as well. So, the best definition of insulin that I use in my exam is that insulin is actually a hormone that brings your sugar down. That's it. Try to be concise as much as you can in your explanation. Do not over explain, or else you'll be in trouble. So, what is type 1 diabetes? Type 1 diabetes causes the level of glucose, sugar in your blood to become too high. It happens when your body cannot produce enough of a hormone called insulin, which controls blood glucose. You need to take insulin every day to keep your blood glucose levels under control. So, you have symptoms of type 1 diabetes, including like feeling very thirsty, peeing more than usual. Now, this patient was also very thirsty. He was peeing more than usual, particularly at night. He was very tired. He is losing weight quite often as well. And the other symptoms were not there. But even if you get two or three symptoms, one or two symptoms, you can at least make a diagnosis in your head, right? So feeling very thirsty, peeing more than usual. He was tired as well. Weight loss was there as well. But they will sometimes also distract you by saying, the mother will say, yes, doctor, he is losing weight, but I think it's because of his food, because he's playing quite a lot these days. So do not get yourself distracted what the patient is saying to you. If they're telling you one thing that is actually making sense, just go on with the diagnosis and tell them the right management. Thrush that keeps coming back, blurred vision, cuts and grazes that are not healing, and fruity smelly breath. Fruity smelly breath, they will give you sometimes when they really want you to diagnose DKA and manage DKA, then they will only give you these symptoms. Otherwise, most of them stations they come with shortness of breath or something, they won't give you this characteristic feature, because anyone can actually diagnose with this feature, right? So they don't want to make this exam very simple and cake piece. Getting tested for type 1 diabetes. So your GP, as he said, that your GP will do a urine test and might check your blood glucose sugar level. If they think you might have diabetes, they'll advise you to go to the hospital straight away for an assessment. Okay, so this is for like the patient who is coming to GP. Okay, but the patient who is on video call, you will immediately send that patient to AIM, not to the GP. But if you have received a patient, like it's an outpatient OPD consultation in GP, then you will refer that patient to A&E, and the patient will be seen by the specialist in 24 hours, not like in 48 hours. So you'll stay in the hospital until you get the, okay, now listen to this again. If they think you might have diabetes, they'll advise you to go to hospital straight away for an assessment. And this slide has been taken from NICE CKS guidelines. You'll stay in the hospital until you get the blood test results, and this is usually the same day. Okay, so the patient should be seen in the same day. If you are diagnosed with type 1 diabetes, you will be assigned with the diabetic nurse, and they will show you the things you need to do to start managing it, such as testing your own blood glucose and how to inject insulin. And then you can just mention the warning signs and the offer leaflets, and I can, whenever you want to book the individual sessions, I can tell you how to end that session beautifully, and you'll be able to cover 5 points in 10 seconds, and nobody will be able to deduct your marks if you've said all things in a right way. So thank you so much, everyone. And we're done with this session. And back in team. we're done with this session today. And thank you so much for Dr. Saad coming and joining us. And he has exam in few days. And also Dr. Matia, who has exam in few days. Thank you so much for joining us.
Thank you so much, Dr. Dure, for a wonderful job. And also, I want to appreciate Dr. Saad and Dr. Maddie for participating in this session.
Yeah, that's quite brave of them.
I enjoyed that.
And believe, yeah. Oh, thank you. And actually, that's quite brave of you guys as well. And believe me, this anxiety is nothing. Participating in front of candidates is nothing. The exam anxiety is much worse than that.
True
if you
that.
can fight this, then you can fight the exam anxiety as well. And you will get the recorded. This is going live as well, so you will get the recorded feedback, and this session is recorded. So it's golden opportunity for you guys to listen to what you were doing in the station, so that you can improve yourself in the real exam. Best of luck, both of you. May you ace your